the fluctuations in the blood sugar level going up and down. So how does that affect the organs of the body, especially the kidney? I think you highlighted that.
Mm-hmm. Yeah, yeah. So, I mean, in a normal insulin sensitive person, you're not going to have much glycemic variation. However, there's a critical threshold, and it's about 180 as far as glucose goes. And that's like kind of a toxic threshold for three specific organs in your body. And it would be your kidneys, your retina, and also your nerves. And this is why we see the microvascular complications of diabetes as far as the retinopathy, neuropathy, and nephropathy. And so what happens is your body's really good at damage control to a point, and it tries to actually pick the least acute problem to deal with. And so what happens is when your blood sugar goes over 180, that is a toxic threshold and there's too much sugar around. And so what happens is the aldose reductase pathway kicks in and it turns the excess glucose into sorbitol. And so now the problem with sorbitol is toxic to your body. And so it's like, ooh, that was a bad idea. Now, most of your body has the enzyme called sorbitol dehydrogenase, which actually turns that excess sorbitol now to fructose. Now, fructose long-term is not great as far as, tendency towards fatty liver and some other metabolic problems, but acutely it's not as problematic, right? And so it's like, okay, well, we can deal with this and then, live to fight another day. So the sorbitol is turned to fructose in most of your body's tissues. However, there are three tissues that lack adequate amounts of that enzyme, sorbitol dehydrogenase, and it would be the kidneys, it would be the nerves, and it would be the retina. And so that's why we see when people have persistently elevated blood sugars, we see the damage to those tissues, particularly in people with diabetes. And so, I think it's pretty cool how all these things, it's not cool when you have those things, but yeah. It's actually very interesting how, it's not just I don't know why this happens. No, this is exactly why it happens. And so, it all is nice. If you follow the biochemistry, it doesn't really steer you wrong.